I'm Michelle. I'm the pharmacist for the emergency department.
The pharmacists are an integral part of the care team. We're involved with interactions with patient decisions every day. There are multiple committees that are formed that include pharmacists, and those committees are formed of nurses, doctors, bedside nurses, care managers, and we look at the big picture, not just what is happening within the pharmacy, but we look at the whole system to see what we can do to keep everyone safe.
We have pharmacists in the Cancer and Blood Disease Institute. We also have a pharmacist in the Anti-Coagulation Clinic, as well as the Heart Failure Clinic, the Cystic Fibrosis Clinic, as well as the Epilepsy Clinic.
The clinical pharmacist is the very front end of the decision of what drug to make. They also assist the Pharmacy and Therapeutics Committee in making those decisions to bring the drug in. But once that decision is made, they are also at the bedside with the nurse, with the physician in rounds, and they help make that therapeutic decision that we're going to use this drug and make sure that it's appropriate dose for that particular child.
Picking up a prescription? Okay. We fill prescriptions for both patients being discharged and patients that are here for outpatient visits.
We have 100 pharmacists and we have about 25 clinical specialists and 80 pharmacy technicians. We produce over 1,300 oral doses a day and about 1,500 IV doses. That's a pretty busy pharmacy.
In the inpatient pharmacy, we dispense medications in single dose tablets instead of like a 30-day supply that you might see on the outpatient side. And those have to be packaged individually, and we use automation for that. Every dose that we dispense is barcode scanned. We also use automation in our pharmacy IV room to make sure that, number one, we're using the right medications in the right amounts, but we also take pictures of all the doses that we make, so if there ever is a problem, we can go back and identify what that problem is.
We have a Parata dispensing robot. It improves our efficiencies. The robot can fill it in like 30 seconds, so it would take a technician much longer to do that. It also improves accuracy.
I know you've done a great job with medications, but we just like to go over them again.
The Pharmacy and Therapeutics Committee reviews all things related to medications within the hospital. The committee helps to make certain that the medications that are administered are safe and effective for the patients here.
As a pharmacist, we are obsessed with safety. It has to be our #1 priority, our #1 goal, and our #1 focus.
We need to know not only the patient's medical history, but we need to know their medication history and know what medications they're taking so that any new medications that we may need to prescribe don't interact with what they're currently taking, and also so that we optimize therapy.
When patients are discharged, some prescriptions are sent to us. We review them for accuracy. Is the right patient getting the right medication? Are there any drug interactions or allergy issues? So we're kind of the last check for patient medications before they leave the hospital. And you are all set. Thank you.
I love the fact that we work as part of an interdisciplinary team and really come up with the best plan for a patient.
We're always innovating. We're always using new technologies to provide safe care and be the most efficient and safe pharmacy that we can.
I think we have the best team out there, and they make me proud. They make me want to come back and do what I do.
It is rewarding beyond measure, and I truly mean that.